Thank you, Dr. Marathe. Uh, in this very useful session of practice management and how to build your practice, I'm going to talk about a topic which is very, very close to my heart, that is pursuit of academics in private practice. As has been mentioned a couple of times in the previous talks, there is a significant change in the pattern of practice, and probably private solo practice, which I started about 31 years ago, is slowly becoming an endangered species. And group practice probably is the new mantra which everybody should really follow, and Dr. Parikshit Gokte will be elaborating on that, but that I think is the new mantra, that one has to go in for group practice, which is very easily said, very, very difficult to follow, because you have to have people who are at the same wavelength as you. It's not very simple to start group practice, but one has to inculcate that habit right from your post-graduation days. Accept that you may have to do group practice. Identify people who are studying 1 year senior, 1 year junior as residents, and then you will be able to know who you will get along with, but have that principle in your mind that at some stage group practice is going to be the answer for today. What is the difficulty or what are the challenges which are faced by a solo practitioner? I feel one is of course the corporate hospitals, which is a big challenge to solo practice. Secondly, charitable institutes. There are so many young practitioners who feel that XYZ charitable hospital has come in the vicinity, and because they are doing a lot of surgeries free of charge, a lot of procedures free of charge, my practice is threatened. Third, a very, very welcome change, extremely good change for the society at large, is upgraded government hospitals. We have no right to complain about it. It's a great thing for the society. And truly, in many cities, many government hospitals are acquiring excellent equipment. A small problem would be sometimes they may not have excellent staff, but at least the equipments have come. With certain changes in rules and regulations, they may get good staff also, but that would prove a challenge to your solo practice. And lastly, unrealistic government regulations. I personally feel that in the last 1.5 years, there have been so many negative vibes coming from the government to solo practitioners. To name a couple of them, it affects in my town and my state. I don't know whether it affects all the states. One is the thing called Clinical Establishment Act. I think it is nationwide. Some of the things in that Clinical Establishment Act are unrealistic. We are just blindly following what are the rules and regulations in the West, what I practice in the UK. That cannot be applied over here. The size of the clinic, the staff. You can do that, but then you will have to charge something like 3,000 rupees for a consultation. That's not possible. So many parts of the Clinical Establishment Act are unrealistic. That was one negative vibe. Second, the dominance of insurance companies, like it is in the USA. They completely dominate medical practice, putting a cap on a particular surgery that will finance only this much. Rest of the things the patient has to bear. Very recently in Pune city alone, we got a very major problem of practically a ban on A-scan biometry, because it is an ultrasonography which certain officers claimed can be used for sex determination, and we were threatened that we will have to close down doing A-scan biometry. Now the ban on Avastin. So continuously so many negative vibes are coming forth that for a solo practitioner it's difficult to fight that. In an institution you have personnel who will still tackle that and you carry on with your work. But for a solo practitioner it is difficult. As far as academics are concerned, it is a prerogative of institutes. There are a couple of reasons for that. There is a lot of impotence, a lot of force in academics that you should pursue academics. The reason for that is there are a lot of incentives to the people who are working in institutes to have academics. If you present certain number of papers, publish certain number of papers, you are due for a very good promotion. In the Western countries, there are some things called as awards, which I'm sure Dr. Parikshit will know. He has worked a lot in the UK. You do certain amount of academic work, you get typically a thing called awards. If you get award A level, award B level, or a second and third level, proportionate to that, your salary goes up. So there is a lot of incentive in institutions to pursue academics. And of course, there will be head of departments and heads of the institutions who want the name of the institution to come up. So there will be a lot of compulsion on the staff who's working there to pursue academics, because the institute's reputation is at stake. As far as an individual is concerned, in career graph, this is not pertaining only to medicine. This is the career graph of any individual in any profession. The first reason why anybody starts work, may not be practice, is monetary gain for self and family. And there's nothing wrong in that at all. Yesterday one question was asked to Chetan Bhagatji that, is it right to be selfish? And he said there is nothing wrong in being selfish. Until and unless your stomach is full, you will not give food to anybody else. So in any profession, it is not wrong to be selfish to a certain limit. So getting money for self and to look after your family is perfectly all right. Later on, we try to obtain recognition in the society. We try to achieve status, like Dr. Marathi said, Dr. Kuresh Maskati said, getting into various societies, non-medical societies, and trying to achieve status. And then comes a stage where you want self-achievement. It is for yourself. You want to achieve something, not just recognition and money. And in the last stage of your career, you get a thing called self-realization. Self-realization means I'm going to do a surgery or a procedure. I may or may not get money. I may not get a pat on my back. Nobody may say you have done good work. But because I know that I am doing it, that work has to be good. That is self-realization. No expectations in return at all, but without any expectations also when I do some good work, that's the last stage of your career, that is self-realization. Pursuit of academics, it is necessary, of course not mandatory for a solo practitioner or for any practitioner. Pursuit of academics is not mandatory, but it's definitely necessary. So we should quickly see how we should pursue academics and why we should pursue academics. How the quickest answer is, of course, attending conferences and CME programs, like all of you are sitting here just now attending a conference. But today the trend is changed, and many people attend conferences purely because you have to get those 6 CME credits or 12 CME credits in a year. Only then you can retain your registration. But that should not be the reason for attending conferences. It should be for learning and updating yourself. What I did in my practice, right since last 3 decades, is I decided to purchase textbooks once in 5 years. I do purchase textbooks once in 5 years. And which textbooks I would purchase? Of the subject of my interest. I could be a comprehensive ophthalmologist, but I will have certain interests even if I am not practicing as a subspecialty. So I would buy textbooks which are of my interest, or my subspecialty if I have one. You know the spectrum of your patients. Everybody has a certain spectrum of patients. Somebody would be getting a lot of trauma cases, somebody would be getting a lot of anterior segment cases. You come to know within 4 or 5 years approximately what is the spectrum or what is the 90% category of your patients. So buy textbooks which would be helpful for treating those kind of patients. And of course, textbooks are a Bible as far as references are concerned. You can subscribe for journals. I subscribed for my first journal in the first month of my practice. I was very scared because I thought it's a very, very significant expense. But I have realized that it is not an expense, but it is an investment to subscribe to journals. It must be, of course, peer-reviewed journals. You do come to know about latest accepted treatments. A word of caution is if you face a medical legal situation, in which case I was involved a couple of times, maybe as an affected person or as a witness. If you quote something and say that this is given in a particular journal, it would be respected, but the judge always asks you, is it mentioned in your textbook? So something mentioned in the textbook is taken by the judge as legally binding. Journals you can quote, but many a times the judges don't accept that, even if it is a peer-reviewed journal. Another thing which I did was form a small group of interested colleagues. Small to medium group. We started in early 80s with just 2 or 3 doctors, then it went on to 5, 10, 20. Beyond a certain limit, it gets out of hand. It has to be a small or a medium group. We used to meet once a month. Discuss simple cases. Now, for example, if you come and attend this conference, you will see a lot of new things which are practiced, new technologies, a lot of studies which are told to you. But something simple like suppose a patient of mine or a couple of patients having a red eye, they are not responding to my treatment. But you have a group of doctors practicing in the local area, very senior people, somebody junior, but as I am written that nobody is big or small, no egos involved in that at all. There may be a young person who will say, because you will have the same demographic patients who you are facing, which could be completely different in Kolkata. If I come from Pune, it will be different. But that small group discusses that, yeah, even I had patients with red eyes and I tried this and that, but you know, this is particular thing which is working. Because there could be a commensal organism in your town which is affecting patients, and that small group discussions with people of your age or senior to you helps you in tackling those cases. Very simple problems, but in those small meetings you get answers, not necessarily in conferences. Different doctors can buy or subscribe different journals, so you don't have to buy all the journals, and then you can have journal readings like journal club meeting, which is a routine in all big institutions of India, and you can share knowledge and problems, and always remember no egos in that meeting. Nobody is big or small, everybody is equal. We can do fellowships or observerships. When I did my MS, one had to go abroad to do fellowships. Today you have Reputed institutions in our country, like the three I have shown over here, Shankar Netralaya, All India Institute of Medical Sciences, PGI Chandigarh, you can do short or long-term courses over there. You can spend time with stalwarts and understand how they have basically become stalwarts like this. If you spend a time like this, even at the peak of your career, if you go and spend a month or 2 months over there, it is not neglecting your practice, it is not loss of practice. Actually, your practice will increase because you are going to come back as a better doctor. And of course, to keep up with academics, the mother of all teachings is the internet. It's a revolutionary teacher. There is a treasure of information, but with a lot of loose ends. If you go too much into internet, it can be confusing or misleading. So we should track internet, but not like patients. You should not Google something. You should not Google mute syndrome and just try to read through it. That's what patients do. You should not follow internet like the way patients do. Internet, you should read, go to sites like PubMed and then seek what you want to read. You can read journals which are free on the internet or pay online and read journals, but you have to be very choosy. You should watch for non-peer-reviewed journals. There are a lot of non-peer-reviewed journals which come. I always used to feel that it makes me feel very small and inferior because there are some fantastic things which are mentioned in that which are actually not peer-reviewed. And you feel so many things are going in, but that's not reality. I always remember one sentence told to me by my teacher: which surgery is great surgery? A surgery which can be done by even an ordinary surgeon is a great surgery. A surgery which is done by a gifted surgeon and he presents something great, but you try to do it, but you will not be able to do it. That is not a great surgery. A great surgery is that surgery which can be done even by an ordinary surgeon. But peer-reviewed journals will show you large studies where everybody can do that, so you should follow that and be a little bit wary about articles which come in non-peer-reviewed journals. There are smartphone apps like iHandbook, EHB, PubMed on tap, or Ophthalmology Pocket, which costs $6, which is something just 420 rupees, which you should subscribe to. Why should you pursue academics in solo practice? Because I feel knowledge is wealth. It definitely gives you immense job satisfaction, and if your knowledge increases, it benefits patients and of course the society at large. I am 100% sure that there is a scientist in each one of us, without exception. But that scientist is like a Kumbhakarna, he's sleeping. So we have to awaken that scientist within you. And scientist does not mean something big. You could just be an academician. Just statistically analyze the data that you have of the patients. Just do a clinical trial. Just come out with findings of your own database. That will be a contribution to your colleagues as well. And there could be some lucky ones, and then that's not just the scientist, but somebody like Professor Charles Kellman. You could be an innovator. We have seen so many innovation lectures in this conference. So you could be an innovator, but you must awaken that scientist within you. Every one of us has that scientist. All of us must practice evidence-based medicine and protocol-driven treatment. This I learned in the United Kingdom. I go and work there, say, for 4 weeks, a couple of times in a year. When I go and examine a patient, I say that you have to have this treatment done. That treatment would be done by somebody else, maybe 2 months down the line. Or I treat a patient whom I have never examined before. Why can this happen? Because there is a strict protocol-driven treatment. What I would advise, 100% every other ophthalmologist would advise that only, because you have to strictly follow college guidelines, Royal College of Surgeons guidelines. So what I advise a patient, the same thing would have been advised by my previous doctor and the next doctor. So for the patient, it doesn't matter who's going to treat because everybody's treatment would be the same. Skills may differ here and there, but that's what should happen in India. You shouldn't say, in my opinion, this should be done. No, it should be evidence-based medicine. Every doctor should talk the same language, and that, I think, is the way forward for Indian ophthalmology. There are a lot of benefits of pursuing academics. It will be reaping a rich harvest materially, morally, and spiritually. And one of the most inspiring persons of our generation, Steve Jobs, I still remember his lecture when at the end of the lecture he said, stay hungry, always stay hungry, so that you will always look to get something and always stay foolish. Never feel that you are very clever. Stay hungry and stay foolish is the mantra which I follow, and that makes me pursue academics even more. You can turn knowledge into money. Of course, it's you who hold the key and decide what you are going to do. I strongly believe that the real measure of your wealth is how much you would be worth if you lost all your money. What would somebody think about me if I have not a single penny left with me because of something? That's my real worth. That can come to you only with academics. Thank you.